From rupees 500 a month to rupees 3 lakhs, that's the range of hair loss treatments available to you right now. And the internet will confidently recommend all of them without knowing a single thing about your diagnosis. Over 1,000 procedures, and this is the video I wish I could hand over to every patient before their first consultation, because it would save them a lot of time. Hi, my name is Dr. Vandana Verma, hair transplant surgeon and dermatologist. Let's go tier by tier. I'm starting here because most of the people skip this, and it's free. Before any medication, any procedure or any product, your body needs a functioning foundation. And for hair, that foundation is surprisingly simple. Sleep. Your body does its repair work at night. Growth hormone peaks during the deep sleep. Chronic sleep deprivation, less than 6 hours consistently, disrupts the hormonal balance. It increases the cortisol and pushes more follicles into the resting phase. I have had patients whose shedding reduced measurably after fixing nothing but their sleep schedule. No products, no supplements, just 7 to 8 hours of sleep. Stress management. I talked about cortisol in another video, but let me repeat it here because it matters. Chronic stress keeps the cortisol elevated. Elevated cortisol shifts the follicles from the growth to rest phase. That is telogen effluvium. The treatment isn't a shampoo. It is addressing what's stressing your body, whether that's emotional, physical, or psychological. Nutrition. 3 nutrients that directly impact your hair cycling. Iron, especially ferritin. I want ferritin above 40 to 70 for optimal hair health. Below that, even with normal hemoglobin, your hair suffers. Vitamin D. 70 to 80% of Indians are deficient. Vitamin D receptors sit directly on the hair follicles. Below 30 nanograms per milliliter, follicle cycling is impaired. Protein. Your hair is made of keratin. Keratin is a protein. If your dietary protein intake is insufficient, which I specifically see in vegetarians who aren't supplementing, hair quality declines. Everyone, regardless of your diagnosis, this is the floor. Everything else is built on top of this. Strong. Multiple studies link sleep deprivation, nutritional deficiency, and chronic stress to measurable increase in hair shedding. Almost nothing. Blood work to check the ferritin, vitamin D, and thyroid level costs 800 rupees to 1500 rupees. And trust me, that is going to be the best investment that you will make. Lifestyle alone will not reverse your genetic hair loss. DHT doesn't care about how well you sleep. But lifestyle issues can accelerate the genetic hair loss and cause additional shedding on top of it. First, fix the foundation and then build on top of it. This is the most evidence-backed oral medication for male pattern hair loss. Full stop. Finasteride inhibits the type 2,5-alpha reductase enzyme. That is the enzyme that converts testosterone into DHT, that is dihydrotestosterone, in your scalp. It reduces the scalp DHT by approximately 60%. Less DHT reaching the susceptible follicles mean less miniaturization. Follicles that were thinning stabilize. Some partially reverse, producing thicker hairs again over 6 to 12 months. This is not debatable. The landmark study 1,553 men over 5 years. 90% of men on finasteride maintained or improved their hair. 75% of the placebo group lost more hair. This is 5-year prospective trial published in peer-reviewed journal. Month 1 to 3, shedding may increase slightly as weaker hair are pushed out. Month 3 to 6, stabilization. Month 6 to 12, visible improvement in density and thickness, and full effect in 12 to 18 months. Honestly, this is where the internet creates more fear than the data supports. In clinical trials, the incidence of sexual side effects, that is reduced libido, erectile changes, is almost 1.5 to 2%. That is real. It is not zero, but it is also not the 30 to 40% that fear-based forums would have you believe. In my practice, over thousands of prescriptions, the vast majority of patients tolerated without any issues. For the small percentage who do experience these side effects, they are very much reversible upon discontinuation in most of the cases. I always discuss this openly with patients before prescribing. Informed consent means knowing the real numbers, not the internet numbers. Men with androgenetic alopecia, that is patterned hair loss. Norwood 2 through Norwood 5, most effective when it is started early. Women with childbearing potential. Finasteride is teratogenic. It can cause birth defects. This is an absolute contraindication. Women with hair loss have different pharmacological options, which I will discuss later. Somewhere around 200 to 500 rupees per month, depending on the brand. One of the most cost-effective medical treatments in all of the dermatology. If you are a man with genetic hair loss and you're not on finasteride or haven't at least had the conversation with your dermatologist about it, you're leaving the most powerful tool on the table. This is the first line therapy, everything else is built around it. If finasteride addresses the cause, minoxidil addresses the growth. Minoxidil is a vasodilator. It opens the potassium channels in the smooth muscles around the follicular blood vessels. More blood flow reaches the follicle. It also directly stimulates the follicle to stay in the anagen, that is growth phase, longer. And over time, it can convert thin vellus hair into thicker terminal hair. The classic form, 5% solution or foam for men, 2% for women, though many dermatologists have started to prescribe 5% for women as well in selected cases. Apply 1 ml, that is 4 pump sprays to dry scalp, twice daily, morning and night. Why dry scalp? Because a wet scalp dilutes the concentration. The compliance problem is real. Studies show that only about 40% of patients continue topical minoxidil consistently after 6 months. It is messy, it is greasy with the solution form. Foam is better tolerated but more expensive, and twice daily is a commitment that most people underestimate. This is a newer conversation. Low dose oral minoxidil, 2.5 mg for men, 0.625 to 1.25 mg for women, taken once daily. Same vasodilatory mechanism but delivered systematically. The advantage? Perfect compliance. 1 tablet, no application, no greasy scalp. Emerging evidence and my clinical experience suggests that more uniform scalp coverage is seen with oral as compared to topical because the drug reaches all the follicles through the bloodstream rather than depending on where you apply it. Side effects at the low dose, you might see some mild facial hypertrichosis in some patients, fine vellus hair on the forehead or cheeks. Rarely ankle edema or postural dizziness at higher doses can be seen. It requires medical supervision and periodic blood pressure monitoring. Low-dose oral minoxidil is currently an off-label use in many countries, including India, though it is widely prescribed by dermatologists. I prescribe oral minoxidil regularly in my practice, but this is not something to self-prescribe. The dose, the monitoring, and the patient selection all matter. The shedding phase is week 2 to 8. This is where most people quit, and it is the worst time to quit. When minoxidil starts working, it pushes the resting telogen hair out to make room for the new anagen hair growing underneath. So shedding increases temporarily. Your hair looks worse before it looks better. This is the drug working, not failing. If you quit during the shedding phase, you lose the new hair that were about to emerge and you're back to where you started from. Except now you have lost the telogen hair that were pushed out. I will tell every patient to at least commit for 6 months before judging. If you can't commit for 6 months, don't even start. Men and women both. All stages of thinning, both genetic and diffuse hair loss, work alongside finasteride, different mechanisms but complementary effects. Strong, it is one of the US FDA approved drugs, decades of clinical data, and one of the most studied drugs in dermatology. The topical one may cost somewhere around 500 to 1000 rupees per month. The oral tablets may cost around 300 to 600 rupees per month, both affordable for the long-term use. Minoxidil is the workhorse of hair loss treatment. It works, but it demands consistency. Intermittent use gives intermittent results, and it's a lifelong commitment. If you stop, the gains reverse within 3 to 6 months.